Although the CDC does not have the authority to officially mandate the vaccines for kids, the CDC's recommendation to add the vaccine to the child and adolescent immunization schedule is the foundation for all the vaccine mandates for kids in schools, daycares, sports leagues, and extracurriculars. My amendment would protect children from the experimental shot by blocking the implementation of the baseless CDC recommendation.
This amendment would set a dangerous precedent for Congress to overrule the scientific process used in determining eligible vaccines for children. Kids may be less likely to get COVID, but why wouldn't we want to continue to protect them? And we need, for immunity's sake, we need to protect the entire population, to be able to protect everyone.
My amendment prohibits funding for the promotion, implementation, or enforcement of the CDC's recommendation to add the COVID vaccine to the child and adolescent immunization schedule. In the fall of 2022, the Advisory Committee of Immunization Practices voted to recommend that the CDC add the COVID vaccine to the child and adolescent immunization schedule, despite having zero scientific evidence for such recommendation. This decision recommended that children as young as 6 months get the COVID vaccine and accompanying boosters. In direct contradiction to the science.
I claim the time in opposition.
The gentlewoman is recognized for 5 minutes.
I rise in opposition to the amendment. This amendment prohibits the use of funds to implement, promote, or enforce the recommendation of the Centers for Disease Control and Prevention to add the COVID-19 vaccine to the child and adolescent immunization schedule of the Advisory Committee of Immunization Practices. The amendment would interfere with the work and purpose of the Advisory Committee on Immunization Practice, CDC's Federal Advisory Committee, which develops recommendations on the use of vaccines in the civilian population of the United States. The Advisory Committee is comprised of medical and public health experts who make recommendations that include the ages when the vaccine should be given, the number of doses needed, the amount of time between doses, and precautions and contraindicators. Before recommending any vaccine, the Advisory Committee considers many factors, including the safety and the effectiveness of the vaccine. CDC sets the U.S. adult and childhood immunization schedules based on these recommendations. The COVID-19 vaccine has already been added to the CDC immunization schedules based on recommendations from the Advisory Committee. This amendment would undermine CDC's ability to engage in its ongoing immunization work, including the safe and effective COVID-19 vaccines. I urge my colleagues to oppose the amendment, and I reserve the balance of my time.